My talk is very focused on access and community outreach and engagement, how community outreach and engagement can help overcome barriers of access. The second part of my talk is to introduce research that we just completed on behalf of the American Society of Clinical Oncology, which partnered with ACCC, the Association of Community Cancer Centers, to create the first unconscious bias training for cancer researchers. So those are the two topics: community outreach and engagement as a way to overcome access barriers, and how to address bias with the unconscious bias training. We know that unconscious bias is a barrier in oncology trials. There's actually research that has shown how unconscious bias manifests in the clinic as we're seeing patients. There was a qualitative study done with 95 participants, which showed that minority patients are often viewed as challenging, and that minority patients sometimes also have specific challenges related to the historical mistrust because of the abuses in cancer research. And in addition, the research highlighted what was meant by challenging. And as you dive deeper into that study, what was meant was that they had additional barriers, such as language barriers, that the majority of patients don't have, which then make it really difficult to not only communicate, but also fit all the work of a provider in a very limited period of time, because when you bring in a translator, it extends the visit and then makes you run behind. And another thing was that challenging meant that individuals, there was a concern that minority individuals may not be adherent to the protocols like the majority was. And then finally, the distrust issues that were mentioned. So we know that as a result of those perceptions, individual providers make assumptions such as, you're not going to be adherent. And that leads to providers not offering clinical trial participation to some groups of patients that those assumptions are made. So that's how it operates in the real world. And that was a tremendous contribution because we got to see what is really meant by bias in the clinic. And so how to overcome that bias? Well, first, individuals should be aware that bias exists, that everyone has bias. I tell people that if you're human, you're biased. And once you're aware, try to seek out additional information and training to help you understand how it operates in your personal ecosystem, not just you, but also those who work around you. And so, and then I would say that the most important thing is actually not even the training, because there is mountains of literature that has shown that unconscious bias training, while important, doesn't lead to behavior change. And for observing behavior change, one does need to change the systems around the individuals that are seeing the patients, the structures, the policies, the procedures, the practices. And if we change that, then we're more likely to have an impact on mitigating and reducing the bias. I don't know if you can completely reduce the bias, but you can come close. So now that I've leveled the understanding of what we know, I'd like to transition to what we did at ASCO ACCC. So understanding that unconscious bias training was not enough, we developed two tools to help cancer researchers out there. So the first was definitely the training, and it's very customized to cancer research teams. The name of the training is called Just Ask, because that's the framework that we try to get across. Instead of making assumptions, just ask individuals about their thoughts, their feelings, their interests, their priorities, their needs, and of course, just ask them about their interest in participating in a trial. And to approach that in a way that you use cultural humility as a framework, in other words, that you put all of your knowledge about the individuals in front of you and their culture behind you, and approach with inquiry to ask them. And that framework of systematically asking everybody for their interest in participating in clinical trials may get you closer to those structures that we were talking about, the practices and structures and policies and procedures. The second tool was a site self-assessment tool to maximize and optimize diversity, equity, and inclusion in cancer research. And what that does is it allows teams and sites and cancer research sites to look introspectively and use this guide to determine, do you have certain practices and procedures and policies in place that we know will enhance diversity and representation in trials? And that includes everything from community outreach and engagement. Do you have the leadership support? Because it has to come from the top. Do you have the workforce in place that really can communicate better and understand the needs of the population, all the way to how are you choosing the trials that you're going to offer? Are they meeting the needs of your community? And how are you designing those trials? Do you have inclusion criteria that won't penalize minorities, won't inadvertently penalize them? For example, if you have, too many comorbidities as an exclusion criteria, we know that underrepresented minorities are more likely to have those comorbidities. And then it proceeds on to additional factors about the culture and workforce training and so on and so forth. So this is a more comprehensive tool. And I would say that the unconscious bias training is probably the first step. And we added a facilitator's guide so that you can download that and bring it to your site or team. And as you all complete the training, that facilitator guide is helpful in identifying some next steps. And then one of the next steps could be that you use as a team this site self-assessment for EDI to identify where your strengths and your weaknesses are, where are opportunities for you to maximize DEI behaviors and practices and changes. So that's what I'll be presenting on with my colleagues. I believe I'm one of 3 presenters for that session, and I'll be the first one to present.